From security, let's move on to health, because some schools in Accra are sounding the alarm over an increase in cases of sore throats and other COVID-19 symptoms among students. According to a notice intercepted from one of these schools to parents, there's a sharp rise in the number of students who report to the school sick bay with sore throats, cold, and severe headaches. The school is asking parents to keep out of the schools such students until they are treated, and those who are brought to school will not be allowed into the classroom. Let me share details of the latest information from the Ghana Health Service, and right on your screens you can see that there is a rise in COVID-19 cases. Now, active cases have been indicated on the scoreboard. Now you can see that out of the 16 regions, 9 regions have now been having cases. The cases are rising in nine regions. At the time that the president lifted most of the restrictions, it was just Greater Accra that had cases. But now you can see that 9 regions out of the 16 regions now have cases. I'll share the scoreboard with you shortly from the Ghana Health Service. You can see active cases, almost 100, and then you can see other information that has been provided by the Ghana Health Service. But joining me for more on this is Dr. John Amoisi. He's a public health expert and lecturer at the KNUST. I'm grateful for your time, Dr. Amoisi, and sorry for keeping you for that long.
Very well, Aisha. It's good to have you this morning.
Right.
And greetings to everyone who's watching and listening.
This is worrying coming from the Ghana Health Service that cases are increasing after we had some time we can call free time when many people stayed away from masks. What is accounting for the recent rise in cases in Ghana?
No, thanks, Aisha, and greetings once again. I think it's really important to take a step back and try to understand what might be happening right now. I'll just share with you a couple of things that can shed a bit more light on this. When you begin to see this upsurge, as has been reported by the Ghana Health Service, what that tells you is that, this started a while ago, maybe about 2 or maybe a little more than 2 weeks ago. Normally, when you begin to see this, uptick in the cases on the board, which is a reflection of the surveillance activity, then it means that some things have gone on significantly before. It's comforting to realize that while we have this uptick in number of cases, it has not resulted in any deaths as far as I know, no change in the number of deaths, which is a good sign, but it doesn't necessarily mean that all is well. It's important to realize that the time of the year in which we are now is your typical flu season. And COVID-19 is a flu-like illness or flu kind of illness. So what you're going to have is you'll have an upsurge in symptoms of diseases which are flu-like. Your cough, your headache, your fever, sore throat, joint pains, these go up in this time in May, June, especially July. And the peak normally is in July towards the end and then entering into August. So what you're having is an increase in the number of COVID cases, but also in the number of other non-COVID flu type of illnesses. Well, first of all, it's really important not to attribute every case of sore throat and running nose and so on to COVID. The other part of this, which is really important to note, and it's 2 things that I want to point out here, which may account for this upsurge, is first of all, we stopped the testing at the airport, and this was perfectly in order. Let me re-emphasize that stopping the testing, the antigen-based testing at the airport, was the right thing to do at the time it was done. I really want to make this very clear, because the thing about public health or global health, for that matter, is you need to make rational decisions based on the data and evidence available, and that is just what was done. However, what this means is that you're trading off your visibility for improvement in the comfort of the people or of travelers, which is just fine. But antigen testing or testing at the airport is certainly a less porous approach than just verifying vaccination among travelers. Because as you know, even people who are vaccinated, fully vaccinated, are able to get COVID. And what happens is that when they get it, their disease is often milder and hardly would they ever die from the disease. And this is what the evidence shows us. But another point is that when we talk about full vaccination, we're talking about having received 2 jabs. A lot of people are not boosted. And so people may have received their last jab or the second jab over a year ago, which means that their level of immunity will wane. What we also know is that if you received a booster dose, you are significantly in a better position or better protected than those who've received 2 jabs. And very interestingly, so far, the evidence is showing that a 4th jab does not necessarily help much more than having a 3rd jab, which tells you that boosting with a 3rd jab is really the way to go. Now we're checking vaccination at the airport, which means that it's certainly a slightly more porous system than testing at the airport, which means that there'll be people coming in who will inadvertently bring the virus in. Then you have a large population of children, who are not vaccinated because we did not have a mandate to vaccinate children in Ghana, which means that there's a lot of unvaccinated people who are children in Ghana. So it's not surprising at all. This combination of perhaps people coming in with the virus and having a huge population of children who are unvaccinated is why we're seeing it in children. Now, the worry is that if the children pass this on to unvaccinated adults, then we could increase our chances of more severe disease and ultimately death. And this is what you don't want. So what needs to be done is we push the vaccination and push the boosting. Even if you've been vaccinated, we had 2 jabs, going in for that 3rd jab, it's free, it's highly effective, highly protective. There's no reason why one shouldn't do that. So definitely pushing the vaccination is important, and also studying the numbers very carefully and deciding whether at some point we want to reintroduce testing at the airport. I mean, if things do continue this way, I won't be surprised if the authorities decide to reintroduce testing at the airport. It will be an inconvenience, but it wouldn't be the wrong thing to do if things continue to go up this way. And definitely the advice from the schools is totally on point. If you have a flu, if you're unwell, don't come to school. Don't bring your child to school. Don't come into the office. And definitely the mask wearing is highly encouraged. I wouldn't be surprised if we begin to get some encouragement to wear more of the mask in public places. I think this is how I'd like to look at it. So far, no cause for alarm per se, but if things continue to go up, then we can move into what I call the danger zone, where people who are at higher risk of severe disease and possibly death might come into the fray. And that's what you really don't want to happen. It's early days, and we have every chance to nip this in the bud.
I'm grateful for your time.